Diarrhea is a common digestive problem. It is characterized by loose, watery stools. Most people experience it several times a year. While usually not serious, it can be uncomfortable and disruptive to daily life. Diarrhea is especially dangerous for young children and infants. Their bodies lose fluids faster, leading to dehydration. This is a serious condition that needs immediate medical attention. Diarrhea is a global health concern. The World Health Organization, or WHO, estimates billions of cases occur annually. Sadly, diarrhea is a leading cause of death in developing countries, particularly among children under 5. This is often due to limited access to clean water, sanitation, and healthcare. Diarrhea has numerous causes, ranging from infections to lifestyle factors. Viruses are the most common culprits, particularly norovirus and rotavirus. These highly contagious viruses spread easily through contaminated food and water, as well as close contact with infected individuals. Bacterial infections are another common cause. Bacteria like E. coli and Salmonella can contaminate food improperly handled or undercooked. Travelers' diarrhea, often caused by bacteria and parasites, is another concern. It affects those traveling to areas with different hygiene standards. Beyond infections, certain medications like antibiotics can disrupt the gut's natural balance, leading to diarrhea. Food intolerances, such as lactose intolerance, can trigger diarrhea in sensitive individuals. Chronic conditions like irritable bowel syndrome or IBS often manifest as diarrhea or constipation. The hallmark symptom of diarrhea is frequent loose, watery stools, typically 3 or more times a day. However, other symptoms often accompany diarrhea, signaling a potential problem. Abdominal cramps and pain are common, caused by intestinal inflammation. Bloating and gas can also occur, adding to the discomfort. Changes in stool color can provide clues about the cause of diarrhea. For instance, mucus in the stool might indicate inflammation, while blood could signal a more serious issue. A foul-smelling stool is another red flag, often associated with infections. Dehydration is a serious complication of diarrhea, especially in young children and the elderly. Symptoms of dehydration include increased thirst, dry mouth, decreased urination, dark-colored urine, fatigue, dizziness, and lightheadedness. In severe cases, dehydration can lead to confusion, rapid heartbeat, and low blood pressure, requiring immediate medical intervention. Section 4. Diagnosis and treatment, a path to relief. Diagnosing the cause of diarrhea typically involves a medical history review, physical exam, and sometimes laboratory tests. Your doctor will inquire about your symptoms, travel history, and any recent medication use. A stool sample might be requested to identify the presence of infections. Treatment for diarrhea depends on the underlying cause and the severity of symptoms. In many cases, diarrhea resolves independently within a few days with home care measures. Resting, staying hydrated, and avoiding foods that irritate the gut are crucial. Over-the-counter anti-diarrheal medications can provide relief from symptoms, but it's essential to consult your doctor before using them, especially for children. For bacterial infections, antibiotics might be necessary. However, antibiotics are ineffective against viral infections and can even worsen diarrhea in some cases. Rehydration is paramount, especially for children and the elderly. Oral rehydration solutions, or ORS, containing electrolytes, can help replenish lost fluids and salts. In severe dehydration cases, intravenous fluids might be necessary. Section 5. Prevention and when to seek help. Staying healthy. Preventing diarrhea involves practicing good hygiene, especially hand washing. Wash your hands thoroughly with soap and water after using the toilet, changing diapers, handling raw meat, and before eating or preparing food. Ensure food safety by cooking food thoroughly, washing fruits and vegetables, and storing food properly. Be cautious about consuming food and water from unreliable sources, especially when traveling. Drink bottled water, avoid ice, and choose cooked foods over raw or undercooked options. Vaccinations are available for certain diarrhea-causing viruses like rotavirus. Consult your doctor about recommended vaccinations, especially for infants and children. While most cases of diarrhea resolve independently, it's crucial to seek medical attention if you experience severe symptoms such as high fever, bloody diarrhea, severe abdominal pain, or signs of dehydration. Additionally, consult your doctor if diarrhea persists for more than a few days. if you have a weakened immune system, or if you have recently traveled to a developing country. Remember, early diagnosis and treatment are essential for preventing complications and ensuring a quick recovery. Please like, comment, and subscribe for more health tips and information.